So, Mr. Adam Farrell is your next patient. He's an 84-year-old guy. He was seen some months ago. He's been seen by the clinic a handful of times now. Ultimately, what has happened is that he had some abdominal pain. Found that he has, essentially colon cancer with metastases to liver as well as to the lungs. And so he's been seen by a number of different services, pulmonology, oncology, surgery, just kind of seeing what the best plan is. And to boil that down, thus far they've started chemotherapy, which he just started, about a week ago. And so for that, he's been getting chemotherapy, had a lot of nausea and vomiting from that. And so he came into the ER this time around because he's had all this nausea, all this vomiting, and they found him to be hypotensive. And so he's coming to you for hypovolemic shock from this, constant nausea and vomiting that he's had for the last couple of days. So they've given him, they gave him 1 liter of abnormal saline down in the emergency room. That pumped his blood pressure up a little bit, and now they're sending him to you just for further management. Right on, sure, yeah.
Yes. Okay. Hi, Mr. Farrell. What brings you to the hospital today?
Oh, just the stomach's been killing me. I've been nauseous.
Okay. When did this start?
Oh, it's been going on the last 5 days or so. Just can't keep anything down.
Okay. So no drinking for the past 5 days?
Oh, I don't drink. It's never been a thing for me. My dad, he's a drinker, but I've never really done it.
Or drinking water, excuse me.
Oh, I just can't keep much of it down.
Okay.
Every time I do, I throw it up.
Alright. So... airway's fine. You check for lung sounds bilaterally.
So, he's moving air. He's got a bit of coarseness to both, on the bases bilaterally. You think you hear a bit of coarseness, crackling kind of sounds on both sides.
Okay. As I'm doing my physical exam, does he look like he has any edema, lower extremity edema?
He does not.
Okay. If I do a IVC ultrasound, this is IVC collapse
There
there.
it is.
Fluids anyways at this
He's got a
point, yeah.
ballot modem, give him a
Even
second.
with
And then
his story.
he brought 38.6. He's probably neutropenic too, so grab some limes.
Okay. So let's start him on a liter of LR.
Okay.
Is my axis still just 2 PIVs?
It's whatever you see.
Whatever you see here.
Look at him real quick
Yeah.
while we're talking to him. Pressure to drop. I'm sorry, Bubba.
Come here, Mr. Farrell. Sorry.
Thank you.
I'm just gonna hook some fluids up, sweetheart.
We can get some labs, CDC, CMP, and ADG cultures. Blood cultures
I
times
can
2.
draw the cultures. I just can't do the gas. So
Okay.
I don't know if you want to talk to RT or if y'all want to draw it yourself.
Do you
Yeah.
want to draw or start an A-line? What do you want to do?
Yeah, let's start an A-line actually.
Okay.
Can I have you?
Yeah, I can do that.
Cool, thank you.
Blood cultures.
So we got blood cultures, A-line, we have fluids going.
Is it okay if I wait to draw these till he has the A line in, and then I can just draw them off the line?
Sure.
Yeah.
Okay.
Okay, cool. I do have your A line set up for you whenever you're
Okay.
ready. It's right here.
Sure. I have an ultrasound that I would have been using.
I think there's one right there.
Thank you.
And there's also the A-line catheter is this.
So 31.6.
Thank you.
ABG is back.
Metabolic acidosis, lactate of 5. He's looking pretty septic in
Right,
this
A-line's
picture. So now that we have the A-line, we'll get the blood cultures ×2 and then start on broad spectrum antibiotics. If I can get Vanc, cefepime, and then what was the, forgetting the name of the,
I don't think we need a fungal
but he's,
chemopatient.
oh, true.
We ordered 50 slabs for y'all.
Yeah.
And if we can start on one of his peripherals with a low dose of Levo,
Okay.
start at 0.05.
Kyle, are you able to just grab me a bag of Levo?
Sure.
And bring it to the room? I can hang it, I just
Sure.
gotta finish these labs real quick.
Just want to give him some more fluid because if we're going to treat him for 6 feet,
Sure.
per kg.
Okay. So we'll start some more. Well, we already have a bag of LR that's going through, right? So
Yeah,
Okay.
that's our other access. Thank you. What did you say that you wanted me to start the Levo at?
let's see. Just double check. A 0.05, I think, would be
Start higher than that.
0.1.
0.1?
Yeah, let's start at 0.1.
Okay. Levo's running at 0.1.
And Steven, can I have you put in a central line
Sure.
at this point too? Thank you. And this is his A line after the Levo.
Everything looks correct.
Okay,
Where do you want me to put it?
let's do a left IJ.
Laying flat.
Can we go up on the Levo to 0.2 or 0.3 actually?
And do we have consent for the procedure?
Oh, we do not.
I got the hurry.
Okay.
He's still mentating, right?
Oh,
Mr.
yeah.
Farrell?
Oh, hey.
All right, Mr. Farrell, we're gonna have to put this IV in you, my darling.
You want to put this drape on? Are you doing the procedure now?
Oh, let's wait. Let's wait because his blood pressure is still pretty low. Sorry.
Okay, well, this is
I'll
here
take
whenever
over.
you're ready for it.
All right. So we went up on the Levo already to 0.3. We're running fluids.
Oh, Levo is up to 0.3. Sorry.
Oh, sorry.
Let me just, I didn't hear that. Let me change that.
And put your head back up, okay?
All right, Levo's at 0.3.
Okay, so that's a little better. We can start some vaso as well.
Okay. Call down to pharmacy. Hey,
I'll
pharm-
do that for it.
Okay, thank you.
I'll go get it.
Give me
Okay.
labs back.
Lactate 5, bicarb 16. I think now we're stable enough to put in the central line because we're going to have to add the vaso. We already have 2 access points that are taken up.
Okay.
Mr. Farrell, we're going to ask for consent to do a procedure. This is essentially a central line. We put a large catheter into one of your veins. This allows us to give you medications and fluids at larger volumes than you normally would get through one IV. There is risks in this procedure. Small risk of there being a puncture in one of the lungs, but we can fix that with a chest tube. There's also the risk of infection, risk of bleeding. Is this something that you consent to?
Yeah, just do it.
Okay, so we got consent. And we'll have you set up for the...
Okay.
Just lactic acidosis we have.
So it's looking like we have a distributive shock.
We have fluids.
He's got a history that goes with this. have we discussed whether or not what his code status is too, given his age and all of his comorbidities, and kind of like if we're gonna trend that way, what we're gonna do there?
That's a good idea. Do we have a code status on him?
I spoke.
He's both on. So I guess we'll hold on the central line because his blood pressure's still a little tenuous.
Alright,
Um,
I'm just hooking up his Vaso to run with the Levo.
Okay.
So I've started the Vaso.
Your banking license here.
Oh, perfect. Okay, what should I do? Are y'all okay? I think this liter is about done. Do you want me to hang the bank in that access over there?
Let me see if we can get another peripheral IV.
I can work on that for you.
Okay. So this is now Levo and Vaso.
I can get another IV for you. I mean, another IV. I can help you. Okay.
Yeah,
Yeah.
that makes me better.
Okay.
This is the bank.
Let's go to legal bank. So 2 pressors going in through 1.
Yep, so you've got this right now,
Okay.
and then
And LR.
we're just, yep, and then he's hopefully gonna get me another IV for this bank.
Okay. Perfect.
Did we get a EKG at any point?
No, we didn't. It's a good
How
idea.
about the banking license
Yep.
here? Always reliable, trusty in the hand.
Yep.
Can we get an EKG as well?
Sure.
Right,
Oh,
this
so
is-
go back to, I guess, knocking out all the other types of shock, right? Even though it is distributive, making sure he's not.
Got anything else going
Yeah.
on too? He's
So
still
it's-
been tachycardic the whole time.
Yeah. He was responding to the pressors.
And you did the one view.
One
Do
view
you
the
want any
IBC.
other
Yeah.
views?
Let's check his heart. Your parasternal lung. Just looks hyperdynamic to me, huh?
Yeah.
Apical 4-chamber. Okay. So don't think it's a pump problem. We'll still check up on the EKG. It just came back. No ST
And you
elevation.
did a X-ray on him also.
No, we didn't. That's a good idea. If we can get a chest X-ray as well.
Just going through our workup for infections.
Right. Let's check. So from the rush exam, there's a couple windows just so we can rule out really quickly if he has any sort of bleeding. So I'll check Morrison's pouch. It'll be back here. I don't see any large areas
So-
that are dark, suggesting blood.
You have an X-ray ready too. Whenever you're ready. I don't want to distract you. So I think maybe we can use this. And then you've got that.
What's this?
That's a port. So we could probably put our pressors into that if we could get someone to access it.
Okay.
And
And then
then
this is
looks like maybe,
infiltrates.
yeah, on the left side.
Are we able to access this port?
I mean, I can call the chemo floor, and see if they have a nurse that can come access the port, but I'm not trained to do that.
And we still have a continued hypotension, so maybe we could call them and at least just have them coming down so that we can maybe switch our pressors over.
Yeah. Yeah.
Thank you.
Come down.
And we can, if we can go up on the Levo to 0.4.
You drop the pressure again to 5. We've got an A-line, we can go a lot rapid. with this.
Yeah, let's do 0.5 actually. That's a good idea.
Because we're getting real-time data, we can go high and then come back down to it.
Yeah. But we're pretty maxed out, right?
No, 1.
Oh, okay.
Technically, yeah, 1. one.
And Vaso, we still have a lot of room to go.
No, Vaso's maxed. It's a static
That's
dose.
right, yeah. So 90 over 60. We have fluids running. What else can we do to optimize his blood pressure? So we don't have a bunch of evidence it's hypovolemic.
So while you're thinking those things out loud, think out loud this way in the form of a sign up.
So
God, I work a lot.
So this is Mr. Farrell. He's an 84-year-old man coming to us for presumed distributive shock. So he had 5 days of poor PO intake in the setting of nausea and vomiting. He also has a fever, 38.6. On exam, he appeared falling down, so we gave him a liter of LR. They gave him a liter of NS and the ED as well. Currently, he's on 0.5 of Levo, 0.03 of Vaso. We got blood cultures ×2. Started him empirically on antibiotics, and are working from there.
Sweet.
Did you see the CBC?
No.
Oh yeah, I saw that as I was coming in. It didn't look so good.
Says he's neutropenic and hemoglobin's down from cytopenia, which is probably all chemo stuff.
I did not see his creatinine or his
So what's up with that heart rate? Is that kind of been where he's at?
He's been tachycardic since he arrived to us.
Sweet.